As of today, 902,446 vaccine doses have been administered in Canada. This means that approximately 2.3% of Canadians have received at least one dose of COVID-19 vaccines, and approximately 0.1% have received 2 doses. It is important to note the progress that has been made in the administration of vaccines in the North. In the Northwest Territories, more than 21% of the population has received at least one dose of the Moderna vaccine. In the Yukon and Nunavut, more than 11% and 9% of their respective populations have received at least one dose of the vaccine. I'm pleased to report that more than 10% of the adult population of the territories have been vaccinated in only 1 week. Given the geography and the challenges of our Canadian winter weather, it is a credit to everyone involved in our northern vaccine rollout that it is progressing well and on track.
Now, let me talk briefly about the next quarter, because this is a long game. Phase 2 of the vaccine rollout will see significant increase in vaccine supply in the next quarter across the country. We're expecting 20 million doses of authorized vaccines to be available starting in April for the April to June timeframe, and may see more if other vaccine candidates receive regulatory approval from Health Canada. So this is part of our continuous work with all stakeholders to support planning and capacity building for the ramp-up phase that will start in earnest in the second quarter.
The question that wasn't answered was, why are we getting less than 50%?
Yeah, this is a question that perhaps my colleague from PSPC, Ms. Ariane Raza, can help me with. But I can tell you that Pfizer indicated a 50% global cut or reduction to the shipments for a period of 4 weeks. We saw initially that we were affected less than others were. Significantly affected, of course, this week, and will continue to be affected for the next 2 weeks. But again, Pfizer assures us that they will recover from that quite significantly and rapidly, and we continue to expect 4 million doses by the end of March. I'd like to point out again that, and I've said this before, this is a bump in the road, not insignificant, but we have to look at the long game, and we do have plans to scale up significantly in the following months. And the vaccines, as you see by what I briefed, will start showing up in greater numbers as early as 15 February.
Can you tell us how this breaks down in terms of how provinces will be receiving doses over the next couple of a week? If you can't give us hard numbers, can you tell us which provinces are going to be hit the hardest?
So provinces are receiving data as we compile the information, as we work this out with the manufacturers. It was noted a 3 weeks back that we would put on our Government of Canada portal the distribution numbers by province and provide as much clarity as possible. Those numbers that we are confirmed as possible it is to confirm. And as we learn, we had those changes with Pfizer that made us revisit that approach at the time. Now that we have more clarity on numbers moving forward with Pfizer, we'll be in a position to post them on a regular basis. Now, provinces have the breakdown. We continue to have the breakdown per capita across the country. We've actually made the adjustments next week so that provinces that were hit most due to decisions made by the manufacturer the week earlier are now we're rebalancing those numbers so that they can continue with their plans, their immunization plans as they had anticipated.
How do you reconcile what you're telling us today, that we're still on track for 4 million doses, and now Premier Moe is saying that provinces that the cut is 3.5 million? How do you reconcile that?
So this is the total number, including the planning data that we shared with provinces for the month of March. Those numbers will continue to fluctuate as we have a decision either to go from 5 to 6 doses made by the regulator in coordination with the manufacturer. At this time, our calculations are based on 5 doses. So given the number of vials that are provided times 5, that's the number of doses we expect to see. Necessarily, we continue to have fruitful discussions with Pfizer, as the 6 doses is not currently approved. We continue to factor with 5, and their commitment to us is to provide 4 million doses by end of March. So those numbers will be adjusted.
Why are some provinces telling David Aiken that it's 3.5 million now? This is thousands, millions of people are watching these numbers. So if that is an incorrect number that the provinces have misinterpreted, I think you. If it is 4 million and not 3.5 million, can you explain where 3.5 million came from? Are the provinces incorrect?
I think I've already explained how we came up with those numbers. Based on 5 doses per vial, those numbers that we're sharing today for February are pretty solid. They're based on a number of vials that we received times 5. Pfizer does number of vials times 6. But understand that Health Canada has yet to approve that. So Pfizer, Health Canada, all partners are very much aware of this. What the data that we have shared with provinces is planning information for the month of March, with the caveat that those numbers remain to be confirmed. It's for planning purposes only, in the range of 400 plus a week, total across the country, and that gives them a figure to plan against. And the number is obviously going to increase in March. I don't know what the breakdown will look like, but it will increase to meet the commitment of 4 million doses by the end of March.